Very, very marginalized. There is not a lot of education. There's a huge amount of fear about it.
There's a kind of a small town thing that goes on here. So the kind of a vibe that if you don't talk about it, it doesn't exist. So, for instance, I think Nova Scotia has one of the highest rates of alcoholism in the country.
Okay.
But nobody drinks here. Of course they don't drink here.
Over here, oh, I'm sorry, you can't do that. We're church people, we don't talk about that. And you're not talking to my kids and you're not talking to their kids or anything else like that. It doesn't happen.
Here's how it would go. It would go like this. How are you? Good. How's your health? Good. That's how it would go. So I think what that kind of represents, all of those responses are a culture of saying what you think people want to hear.
Because there's other things that people ought to be talking about and concentrating on and spending their money on. Because HIV is not an issue in Nova Scotia, would be a simple answer.
If you're outside of the mainstream, you're not supposed to talk about that. You can be it, but not here. You be it, but get out of here if you're going to do that stuff.
If you say somebody's got cancer, everybody rallies around and they look after you, and it's a very, very community-based province, and literally the community will rally around. If you've got cancer or a kid is sick or something like that, you've got HIV, you're on your own.
A lot of my friends don't even know that you can get to a point where you're not transferable to other people. Like they think that it's still, oh, well, they just maintain their HIV. I'm like, what do you mean maintain their HIV? What does that mean? And they can't explain it. They don't even understand that.
Nobody understands exactly what it is, and nobody understands what makes it tick anymore. Nobody understands how it's transmitted. They still think you can get it from a toilet seat.
Ignorance. Yeah. Testing policies.
A, HIV is not an issue in Nova Scotia. B, we don't need to have testing anywhere but beside the infectious disease clinic, which would be in Halifax. So that's a bit of a problem.
The contradictions in terms of doing campaigns, telling everybody go and get tested, protect yourself, et cetera, and then reducing testing all over the place and who can get tested and where they can get tested. And the fact that in a lot of our provinces we don't even have anonymous testing available in 2 of our provinces in the Atlantic.
People still attach the stigma that I don't want to be associated with you because then I'll be accused of having it as well.
We obviously have a lot of stigma dealing with a very rural area as it is, and a lot of people don't want to even go in the doors to get and even ask for that test because it might be your aunt that's doing the test, especially in really small towns. So it's very frustrating.
Access to services, so with centralization of a lot of services in Halifax, for specialist care you have to go from that end to that end, which is 4 hours this way and 5 hours that way to get to the hub. Lots of small hospitals have closed or reduced their hours, so there's some concerns about whittling away the model of put it out there in a variety of locations so people have choices about accessing services rather than centralizing services and expecting everybody to find their way to those services.
How can we expect people to actually seek it out themselves when it's so darn confusing?
I think we need to know where there are testing sites available.
Okay.
That would be one thing.
Income, poverty. People had money, feed their kids.
Did I mention that the other one is the public health system in Nova Scotia is flat broke? So we know that poverty is the key driver of HIV. So if you don't have affordable, accessible, safe housing and you are living on the street and you're whatever, all of those things are going to yield potential poor health outcomes, including the possibility of bloodborne pathogens such as hepatitis, HIV, etc.
People get confined to their communities because you have, kind of like what Cindy was talking about yesterday, you have methadone, mainline, and you have the shelters all in the same vicinity. So it's like even though people are getting a treatment, they can't escape everything that they were trying to escape previously.
Some of those structural inequalities that fuel poor health outcomes need to be looked at further upstream, and I'm not just saying that as a professor of health promotion because that's what we do, but putting money into what has been referred to as essentially a broke public health system would suggest that saving $150,000 and preventing some kind of an infection probably makes sense to do that further upstream, or have a combination of things. Ask people if they need housing, do they need food, do they need those kinds of basic necessities, and then add the other bits on that would be probably closely connected to HIV.
We need to talk about not only about HIV, but we need to talk about sex. We need to talk about relationships. We need to talk about taking care of ourselves. We need to talk about those things, those broader issues that put people at risk, like poverty, like racism, like stigma, like homophobia. I think there needs to be, we have to recognize that those things put people at risk.
I do have a chronic illness, which has helped me come up with the point that I'm going to be talking about with my friend Maya today. You want to start?
Basically, the sort of what came out for me during these conversations today was the fact that I feel like in this discourse, when we're talking about treatment and prevention, something that's often neglected, at least that's not publicly explored or depicted, is the fact that there is a life after diagnosis, and there is a life for people who are positive status, and I feel like that's something that should really be sort of depicted more generally to the public, so that it's not just sort of this dropping off point of once you receive your diagnosis that essentially there is no continuation there for you, and to show people who are positive but who are still living very full and happy lives is really important in sort of reversing the stigma, because it is important to focus on prevention and effective treatment, but also on destigmatizing and having greater social acceptance. So I think that's something that needs to be focused on.
It becomes crippling to think about ourselves through like the stereotypes that happen in the society. Oh my God, I'm HIV positive. My life is over. Not at all. I think that having a chronic illness and something so severe gives so much beauty and like introspective and perspective to understanding and like relating to. Yeah.
Interestingly enough, there's an NDP provincial government here, just elected, in a history in this province of real conservative, like it's been conservative forever. If my father knew that I ever voted NDP, he would roll over in his grave, for sure. For sure. But they have an NDP provincial government. So something's going on, but I'm not sure what that represents.
HIV is there. We got to deal with it, and we've got to learn to accept it. If you can't accept me and my friends, then you know what? There's the door. Walk out what you came in.
People have to pull their heads out of the sand, or their asses, and actually really, really face it.
As long as that thinking about it's not our problem is left to fester, inaction is the inevitable result.
It's an issue that needs to be discussed more. And it's not just an issue that exists in Toronto or Montreal or Vancouver. There are people living with HIV, and I myself am a person living with HIV, and there are quite a few of us, both men and women, and of all ages and shapes and sizes, who are here in Atlantic Canada living with HIV. And there are others here as well who are HIV positive, but who don't know they are. And I think it's important that they find out who they are for their own health. In some ways, we are all part of the problem, but in the same way, we are all part of the solution.